You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. We've had him on the program before. He's got a stack of before and after photos, and he is Washington's go-to implant dentist. We have Dr. Tyler Tolbert. Dr. Tolbert, welcome to the program.
It's good to be back. Can't believe you got me back on here, but it's not too bad.
We wanted you back in here. I know you brought a stack of photos, a lot more than last time, so we'll try to get to as many of those as possible. Now, for people that don't know your practice, like who's the typical dental implant patient?
Yeah, so I mean, I would say that really falls into two major groups, right? Okay. So you have people who don't have any teeth anymore, right? Yeah. So they've been wearing dentures. And then you have people that are being told that they're more than likely going to be ending up in dentures. They've been going through this, treadmill of having to go to the dentist and get this fixed and that fixed and this hurts and this doesn't look so good, right? Teeth are breaking down, they're falling out, their gums are bleeding, they got bad breath. By the time they fix one problem, another one's already turned up. Okay. So they're looking for a new solution for that. And so they've been told that they're going to be getting dentures. And for those people, we're going to give them a brand new set of upper and lower teeth that don't have to come out.
Okay, that's nice. Who's the second group?
So the second group are people that we can probably help the most, and that's the ones that are already in the dentures. So they've been coming to the dentist, and instead of getting their root canals and their crowns and things like that, now they're coming back every so often for an adjustment. They've got a sore spot, they've been having to glue their teeth in all the time, they're having to get relines, things like that, and they're looking for something different too. So for them, of course, we can give them teeth, upper and lower, in the same day that don't have to come out.
Now you said that a denture wearer, if everything works out, the morning, they can walk in with no teeth, and maybe 12 noon or 1 o'clock, they can walk out with upper and lower teeth that don't come out.
You heard me right.
Has that ever happened?
It is a regular occurrence at our office, absolutely.
Now, are there a lot of people in Washington? Because when I think of and you're from the Tri-Cities, you think of a healthy area. Are there a lot of people wearing dentures or headed to dentures?
So there's so much more than you would ever think. There are literally tens of thousands of people, maybe even as much as 100,000 in the area that are dealing with at least, 4 or 5, maybe more than 9 teeth. There's tens of thousands that have no teeth at all, and you never know it. These people are experts at hiding their situation and not smiling and not advertising that they're dealing with this situation, but it's silent suffering.
And when we talked on the phone, anticipating you coming here, you say a lot has changed. In fact, I think you said everything has changed. Yeah. So what's changed now for the better when it comes to getting new teeth with implants?
So what we're able to do is make this process even smoother and even more expedited than it was before. What we're able to do is get you from the situation that you're in to new upper and lower teeth that aren't coming out in as few as 2 appointments. And we're able to do this without impressions. We're able to do this with...
What does that mean, without impressions?
Right. So typically when you go to the dentist, everyone's had that experience of having that goopy tray go into your mouth.
Yeah.
Things are running everywhere and you're having to clean yourself up. We're not having to do that anymore, fortunately. So we're able to do this with highly advanced
Like a little
technology.
camera that goes in their mouth?
It takes thousands of little photos. It's just like a little wand. It's just taking little photos of your mouth. It's almost like brushing your teeth. It just goes all the way around the mouth, takes all these photos. We take some photos of the face and different dimensions there, also that we can bring everything together and get a virtual image of what your head, your face, and your smile all look like, and dream up what you want to look like. And that is something we're able to do in very little time now. And so once we have all that data, we're able to go ahead and make those teeth using an in-house lab. So this isn't being done in the old school way. We're literally being able to print the teeth in the other room while we're working on you. So those are ready just as soon as you're ready.
So you make the teeth right there?
Right then and there, absolutely. They're getting printed off. But I'll tell you something that's changed for me personally, more so than all of that technology and all the advancements that we've had, is seeing how much a person changes from the inside out once this is done. So, they come in, you get sort of an impression of who this person is. They can be maybe a bit guarded, a bit reserved. Maybe they're not smiling or laughing a whole lot. And then they go and do this, and the next thing you know, you're meeting an entirely different person. They're smiling more, they're cutting up, they're joking, they're dressing better, and they're making altogether totally different impression than when we first met them. So I always make the joke, we get to meet people twice in our office.
Okay, now in the Tri-City area, or throughout Washington, we talked about this on the phone, that how it's typically done, and correct me if I'm wrong, we want to make sure we don't exaggerate here, but it's typically done in 2 or 3 offices. You go to one doctor that does the surgery, periodontist, oral surgeon, and then you go to another doctor that puts the teeth on top, and then you get them maintained elsewhere. Now you do all 3 parts right there.
That's right.
Is that why you do it so quickly?
So, I mean, unfortunately, it's an even more laborious process than you just described. It is accurate. So, yes, we do everything in-house. So, the person that is, placing the implants, that's making the teeth, that's maintaining the teeth, that's all right here. So, the buck stops with me, and it's all happening within our office. You're not having to go all over the Tri-Cities and all over creation trying to get your mouth fixed. Now it's a one-stop shop.
Now, when it comes to dental implants, I think you called it the dream office or your dream office, what you've always wanted.
That's right. I think we've created the most state-of-the-art dental implant center in all of Washington.
Yeah, but isn't it true, though? I mean, if you've been wearing a denture, let's say, 10, 20 years, you can't do this. You don't have enough bone.
Well,
is that true or not?
It's true that that's being said, and people are told that every single day. And you know what? In the offices in which they are told, that's true. I don't think it's a dishonest thing. But the reality is that there are so many techniques now. There's so much more technology now that allows us to utilize that and make things possible that just weren't possible before.
Okay, nice. So you brought some photos. Let's take a look.
Finally, that's my favorite part. So I want to show you Betty. So Betty first came to me because she goes to her weekly bridge club and she has all of her friends, and they had been talking about their dentures and issues that they had been having with them. And she hasn't even, at that time, she didn't even have teeth at all to smile with. So she was mostly just kind of showing her
lower teeth. That's it.
Just the lower teeth, pretty much acting like that's, what she was working with. And, she still has a very bright personality, but ultimately she wanted to see what her options were for getting her upper teeth back as well. So what we did for her, and she had no clue this was even an option, is in the same day we were able to have her come in. She had no teeth up top. By about noon, 1 o'clock or so, she's walking out looking like that. So those are teeth that do not come in and out. She's never had to touch any denture adhesive. Forget it. Those are screwed in. They're not going.
It looks very nice, by the way.
Randy, what I really want you to look at here is look at how those teeth perfectly fit her face.
On the after. Okay.
Right. Now, that's not just like we took a shot in the dark and we got lucky. Okay. That is a matter of science and a matter of art. So we knew exactly what her facial proportions were because of all the work that we did when we first saw her at a consultation.
And this is done like on a computer. So you're designing.
Exactly.
Is that right?
So we were able to map out exactly where her teeth needed to be, even though they weren't there at the time. And so when she got her teeth, instantly you see a mouth that you see all the teeth fully filling out her smile. There's no dark corners in the smile anymore. You see beautiful, brilliant white teeth. And of course the appearance is a great thing to look at, and she's very happy with it. But for me, just as a doctor, what I have really grown to appreciate is how much healthier she is now. She has so much more being put back on her plate. Broccoli, vegetables, fiber, all the things that her physician has been telling her to eat, but she has been powerless to do. All those things are back on the menu, and she's getting so much more healthy. Her diabetes is better in control. Everything's turned around.
So you can eat, like, bite a carrot with your front teeth.
You bet. Absolutely.
Corn on the whatever. There's no limitations, or you have to be careful with the front teeth.
I don't recommend eating rocks or ice.
Okay, but you can eat whatever you want.
Absolutely. That's the whole point. I don't see any point in calling this a full life transformation if some things are still going to be restricted from you. If you go through this, you're going to be able to eat whatever you want.
What do they like more, the way it looks or what they could eat?
It's a toss-up. I think, it's a question of which thing makes you feel better, and I think it's a pretty stiff competition. So when people are smiling and they love what they look back and, see in the mirror or in a picture, that makes them very happy, but they also feel better because they are literally healthier. This interplay between mental and physical health is something we're still learning a lot about, and what we're seeing is that from both ends, we are improving that.
Yeah, but what if people lost their teeth because of bad gums? Are the gums good enough to do this?
Yeah, so that's a great question. So one of the things that is giving people all these issues with their gums is diseased teeth. So we talk about periodontal disease. That's disease that is around.
It's an infection, right?
It's an infection that's around the teeth. That's literally what the word means. And so once those diseased teeth are out, the gums want to be healthy. Now we've taken away that thing that's irritating them, and they're actually able to restore themselves. These gums aren't inherently bad. They've just been having to deal with diseased teeth. So once that's gone,
the bacterial infection goes away.
The bacterial infection is gone. We take care of that at the same time, and we're able to put the implants in and get you new teeth at the same time that are going to be healthy and maintainable for a long time. So now I want to show you Greg. So Greg had come to me, and I was definitely not the first dentist he'd spoken to about a situation. So Greg is a grill master, and he makes amazing barbecue, amazing steaks and everything. He brings all of his friends over, and he puts a bunch of meat on the grill, and he serves burgers and steak for everybody. But it's actually a little bit of a tragedy. He could not eat his own food efficiently.
Is that what he told you?
That's right. Absolutely right. And so, he has this issue with not really being able to eat very well. And, he won't talk too much about not smiling much, but he's not doing a lot of it when I first meet him, right? So I'm not really seeing what his situation is. And honestly, I didn't even fully understand that he didn't have any teeth at the time. He didn't even have dentures. He tried it. They weren't fitting. Right? They weren't fitting. They were coming out. The adhesives getting in his food when he's trying to eat. He was frankly just kind of gumming it through most of his meals. That's a really tough time. And he'd been told that he didn't have enough bone. He was told that this just wasn't going to be able to work. It was going to be a really long process, having to graft the bone and everything. So he'd essentially given up. He said, you know what, I'm a cook for other people. And then what we were able to do with him is he came in, we got him a whole new set of upper and lower teeth that did not have to come out, and he was able to eat his steaks, eat his own burgers, and now he knows just how good of a grill master he is.
Is that him over there?
Yes, it is. Yep, I want to show that to you. So as you can see, that is a full mouth of teeth.
Not even the same guy.
That's right. That's right. So he's got full mouth of teeth. He's got all of his back teeth back. He's got a beautiful smile. And what you know it, he's smiling all the time. He's got a whole new personality now. And when you look at that before and after, wouldn't you say he looks younger?
A little younger.
More sophisticated, more educated. These are not things that he was particularly concerned with.
You were telling me this on the phone, and I always feel like it's an exaggeration, but I think when you look at it before and after, he does look a little more successful, a little more educated.
Absolutely. It makes a totally different impression. And now
changes the appearance.
He's lighting up every room he walks into.
So what does he like more? The way it looks? Because he went without teeth for a long time, or what he can eat. He must love the eating part.
I think he knows he's very handsome, but at the same time, he's also a very mean cook, and getting to eat his own food is something very special for him.
And no limitations. I mean, he could eat whatever he wants.
Absolutely. Absolutely. Okay. Yes, sir.
Okay, good.
Yeah. So I want to show you another one. So this is Beth. So Beth is a health and wellness coach. So she helps people with, chronic conditions, diseases, pains, aches. She addresses all of their emotional health, their physical well-being, all these different things. But within her own body, she was having these issues with her teeth. She has decayed teeth. She was losing them. She was losing bone. She had bleeding gums. And it was something she was very guarded about.
So even if you brush and floss and gargle, this bacterial infection you just can't get rid of.
So let's make no mistake. This is a health and wellness coach, and she's a person that practiced what she preached. She was always brushing her teeth. She was always flossing them. She was going to the dentist regularly. But for some people, not even that is enough. There are just so many things that go into the situation. And so for her, even being a person that is so serious about her health, it just wasn't enough to maintain her natural teeth.
So a denture would have been her option.
She was absolutely heading towards a denture, you bet. And so, this is still a very young, bright, vibrant woman who wants the most out of life and is doing the work every single day with her diet and in the gym, and her mouth just wasn't really reflective of that. So what we were able to do for her is go ahead and get proactive about it before she ever has to go into a denture. We took the decayed teeth out, we got rid of all the disease, all that infection, and we gave her whole new teeth. And now this is a beautiful, healthy teeth.
Looks good.
She smiles so much better. You look at this smile, that doesn't quite look like the same person to me.
Yeah.
This looks like who she may have been 10 years ago. We reversed time for her.
What's it like when a person like this looks at themselves in the mirror for the first time?
This is always a really incredible and emotional moment for us. So our team refers to it as the mirror moment. So this is when the patient is seeing their new selves for the first time.
All right.
And even though this is on the day where all this has happened, it's amazing to see how much emotion can come out of these people, because they're not the same people they were when they walked in. And then they get to see a reflection of that as well once they go back into the waiting room, and their loved one who brought them to the appointment is there too. And then they see the transformation has happened, and then they're getting choked up and everyone's getting choked up. It's always an incredible emotional moment, and something myself and my team really relish.
You say people hold on to their teeth too long. What does that mean?
So what happens is this situation gets to a point where it gets a little bit out of control, and it's really started to negatively affect people's lives. And I think people are concerned with what's going to happen next. And a lot of people are believing that what comes next is dentures. And so they're not in a place in life where it's hard to be in a place in life when you're ready to be taking your teeth in and out. People want teeth that stay in all the time. You don't want to have to be conscious of this when you're eating and when you're speaking to your relatives or when you're smiling at your child's graduation or something like that, right? So they do put up with this situation sort of in this false hope that things are just going to turn around on their own despite all of their efforts. And so what is amazing for us is to then take that situation, show them a different way, and make it happen relatively instantly.
And do they regret like they didn't do it earlier?
Every time. Every time. So no one ever regrets doing it. They always regret not having done it a year ago, 5 years ago, 10 years ago, sometimes more. I mean, people put up with this for a long time.
Like, what's the upper rate? Like, how old can you be to get this done? Like, what's your oldest patient?
So not too long ago at all, I actually treated someone that was 96 years old. So they were dealing with dentures. They've been dealing with that for a very long time. I think they'd actually been a denture
96? Why would a 96-year-old want to do this?
Well, simply because a 96-year-old has to eat. And what else are you doing as a 96-year-old? You're wanting to travel and eat other things in other countries and wonderful places. And these people are restricted with what they can do when they go places. So yes, they want to eat, of course.
So a 96-year-old, you gave an upper set or lower set of teeth that don't come out?
Whole mouth.
Or both?
Upper and lower, neither were coming out and never will. And this 96-year-old was wearing a denture when he got to me. I mean, he was basically chewing like a cow, just sort of grinding things around. Absolutely. And now, with new upper and lower teeth that aren't having to come out, they're getting more out of everything that they do. Any place that they go to, they're not having to restrict themselves of what they can experience.
I mean, 96, were you a little nervous when you were doing it? A little bit? Really?
No, not at all.
I mean, statistically, are they more likely to fall out on a 96-year-old?
No, not at all. No,
really?
No. Once you have good implants in bone, you don't have to be concerned about things falling out. These things are very rigid. So when a 75-year-old comes into the office and tells me that they're too old for teeth, I'm thinking, well, you're barely even up there at all, right? I mean, I'm treating people that are 96 years old that are benefiting massively from this procedure. So, you know, it's all very relative, but a 75-year-old is not old in our book at all.
So you think it's especially if you're older, you should do this? Because your life revolves, you're probably not working. You want to eat and all those things.
What is the latter half of your life worth if you're not able to eat what you want? It's as simple as that.
Okay, good. So now what if they're on medications? Like, because most 75-year-olds statistically are on like 4 or 5 medications. Do your patients, are they on medications?
Yes, absolutely.
So you can work with them?
Sure.
Diabetes medications?
Well, one of the beautiful things about this is, yes, of course, a lot of them are on medications. In fact, I would say all of them are on medications. But what happens is, once they're able to eat better, they're actually taking less medications over time because they are able to control their diets better. They're able to eat a larger variety of foods. We're finding out, and this is all coming out in the research, that the more of a diverse diet we have, the healthier we're going to be. It's preparing our bodies for all kinds of different stimulus and things. So people are getting a lot healthier from this.
And the way you have it set up, would you, and I'll put you on the spot here, do you think you're doing it at the highest level in the Tri-Cities area or Washington? What do you think?
I am confident that we are using the most advanced technology on the market today that allows us to do the best standard of care that's available.
Okay, good. More photos you have.
All right, absolutely. So I want to introduce you to Joseph. So we were already on the subject of age. So you wouldn't know it if you met this person at first. Joseph is actually about 80 years old. So Joseph works out.
Okay.
He keeps a very young appearance. He dresses young. He has a vibrant personality. But the thing that was holding Joseph back the most was the smile. So Joseph was very guarded, actually mumbled whenever he would speak to me. So I'm seeing this person who's young and vibrant, full of life, but there's just something that they're holding back with. So what we were able to do
So he never smiled?
No, not at all.
Like he was very self-conscious of his
No, and it was almost this walking oxymoron. You've got a person who, you know, is dressing very young and is clearly taking care of themselves, but isn't acting happy about it. So his option would have been a denture, and there's no way this guy was going to go for a denture. Dentures are for old people. It makes you feel old by having a denture, teeth that come in and out and get in a cup at night. But fortunately, Joseph's never had to do that. So Joseph has upper and lower teeth that don't have to come out. They're permanent, and now he looks as young as he feels.
Look at his 80s.
The whole portion together. You've never seen an 80-year-old that young. and he looks a lot younger. Finally,
yeah, that's for sure.
His personality is matching his appearance, and the way he walks in and what he's wearing and all that good stuff, it all just makes sense. It's cohesive. This looks like a young person. You'd never guess his age.
Now, why do you say they have to learn to smile all over again? What do you mean by that?
Because they've forgotten. It's been so long since they've been smiling that they literally just don't know how to do it. And it's funny because a lot of these patients, you give them these teeth and they're beautiful teeth that fit their face perfectly, and they should be able to smile, you know, from ear to ear practically, but they don't really know how to do that. So there's this period of having to unlearn how to hide themselves.
They have to get a few more compliments, and next thing you know, what? They're smiling all over town?
Before you know, you can't stop them from smiling.
So age doesn't matter then, really?
No, it's not really a factor.
Okay, good. So you have more photos. What
Absolutely.
else are we looking at?
So here we have Claire. So Claire works at a bank. She's a bank teller. So she is the first face that someone sees when they go up to the desk. And what she had been getting feedback from with her team is that she always just kind of had this very reserved, very quiet personality. She was good at her job. She knows what she's doing, but she wasn't this, ray of sunshine whenever people would be coming into the bank. And so
she never smiled.
She never smiled. She never smiled. It always seemed like every day was a Monday. I'll put it that way. Okay. Now she has upper and lower teeth. They're not coming out, and
she seems too young to be wearing a denture.
Absolutely.
And that was her option?
That was what she had been told, and this was just not a person that was going to live with this lifestyle. She's a very young person. She has so much going for her, and to be taking her teeth in and out and gluing them in throughout the day, that was just not something she was willing to do. So she put up with this situation for quite some time, and I want you to take a look at this after. So this kind of speaks to that last point. You can see in this smile, it's a beautiful smile. Those teeth are great. But it's not a natural smile. It's kind of forced. She's learning how to do this. She's still receiving those compliments. She's still getting that reinforcement that now she has something to show off. So this is still kind of a progress photo. I want to see her back in a few months. We'll take a new photo, and you're going to see a genuine smile. But you can already tell she has a lot to show for it. All right, let me show you this next picture.
Okay.
So this is Charlie. So Charlie's daughter was getting married, and Charlie never smiled for photos. And something his daughter was on him about all the time was, "Dad, I want you to smile at my wedding." And so he came to me with this situation. Nice. The wedding was in a very short term. I think it was within maybe like a month and a half, 2 months. And he's being told he has to get dentures, and there's going to be 12 appointments and all these things. That's not what he was looking for. And so what we were able to do for him is he came in, we had his consultation. The next time we saw him, we completely replaced his situation. So now he's got upper and lower teeth, and he's smiling.
He looks good.
All the time. Right there.
Looks very nice.
And I'll tell you something else is, when he's at that wedding and he's smiling and everything, he was very happy about the decision he made. But another thing he found out on that day is, look at this. In his before, you can only see one tooth there. There were no back teeth. He was not going to be able to eat all the things that were at the banquet for the wedding. He wasn't going to be eating along with everyone else. And here he is, and he's eating whatever he wants. And so he got so much more out of that experience and a much fonder memory.
And then for maintenance, they just come in like every 6 months or a year, just like a regular teeth. Is that right?
Absolutely. So they come in, they get some new images, we check on how everything's going. It's always a fun time just to kind of catch up on how people are doing and how this has all changed their lives, because as this goes on, you just see more and more positivity, you see greater things coming from people, and that's always a great touch point for us.
Very nice. Okay, you have a few more. I'm going to rush you a little bit. We're short on time.
Sure, no problem. So here we have Ronald. So Ronald has a very familiar story that I think people can relate to. So Ronald was struggling with periodontal disease, right? Gums were bleeding all the time. Teeth were all getting loose. He was being told every time he went to the dentist that, you have so much calculus. That's all the tartar that builds up on the teeth. Now, Ronald takes good care of himself. He was always looking after that and doing everything he could, but it was just the situation that no matter how hard he tried, every time he went to the dentist, he was getting disappointed.
Okay.
And again, his option was going to be a denture. That's what 99% of other offices would have told him, is you're going to have to go into a denture. There's no other options. There's no single tooth dentistry for this person. But now, look here. So you've got a full mouth of fixed teeth that he's showing off all the time. There's no more loose teeth. That's never going to happen to him again. These are much easier for him to clean. They look better. And now you can kind of see that inner brilliance is now being reflected in his smile.
Now, as far as pain, because it seems like a painful procedure.
Right. So something that I actually get all the time is that my patients came in with more pain than they left with. And what I mean by that is, just on a day-to-day basis, what these people are tolerating in terms of pain is a higher kilter than what they're having in the day 1, 2, 3 days after this procedure. And they were numbed up the whole time. They were asleep for it. They went in one way in pain. They came out without pain.
So everybody's getting sedation,
of course,
for the most part.
Yeah, absolutely. Of course, everyone's going to sleep and waking up with new teeth.
You said they don't even remember getting it done.
Yes,
is that right?
That's the beauty of it. There's not really any memory of what happened. They might have some memory of the morning of or something like that, but nothing actually really happened in order to get them to this new smile.
Is it more men or more women that are doing this?
Even keel. I'd say it's about 50-50.
Do you ever have couples doing it?
Oh yeah, all the time.
Is one like the guinea pig that goes first?
There's always one, brave soul, I suppose, but then not long after, and sometimes even simultaneously, the other partner will usually want to get it done, because you can't have one having this brilliant smile because it creates this, contrast, right? You want to have matching perfect smiles.
So we say at the top of the show, we say no more dentures.
That's right.
You believe that? Is that the future of dentistry? Like dentures, traditional dentures as we know them, will be gone. Everything will be attached to something.
That is the future that we're trying to craft at Smile Now Tri-Cities. That's right.
Okay, you're doing it right now.
Yes, sir.
Okay, good. Time for a couple more.
Sure. So what I have here is Chuck. So Chuck is a general contractor. he was born with missing lateral. So that's the side teeth next to your front teeth. It always kind of made his smile look a little bit funky. Even though he took relatively good care of his teeth, things just didn't always look good. He wasn't happy with his smile. He actually jokes to me, his mom once told him, well, you're not going to be pretty, so you better be smart. And so he went and he started this business. He became wonderfully successful. And now he has all these resources. And he says, you know what, I'm going to take care of myself. I'm going to see if I can do something about this smile. And I'll tell you too, I don't remember everything exactly about Chuck, but it hurts when you're eating. When your teeth are not quite right, they're misaligned, or you're having bleeding gums and decay and things like that, it's not fun. It's not really an enjoyable experience to eat food. This person right here, eating meals is a happy experience.
Very nice.
All the way through.
So again, he would have been wearing a denture.
100%.
So these are upper and lower teeth that don't come out.
Yes, sir.
He does look younger.
That's right. That's right. He looks younger.
What's he say when it's all done? Do you remember?
He said, I wish I'd done it sooner.
Is that pretty much? Do patients ever say, Doc, you've changed my life?
Well,
you hear that?
I do, and what I always reflect back to them is that they changed their lives. They're the ones that scheduled the appointment, came in to see me, and see what it could be done, right? These are the people that took their life into their hands, made a decision.
Because nobody likes going to the dentist.
Nobody
Do you ever
likes
hear
to.
that? Like, no offense, doctor?
Oh, that's the first thing they tell me.
Really?
People will tell me they hate me sometimes, but I understand where
Do you have
that's
a
coming
secret challenge when somebody doesn't like the dentist that you're going to win them over? That when this is all over, that they're going to love it?
It's not so much about patients liking me. I just want them to like themselves.
Okay.
And a lot of times
okay.
I see that. Yeah.
All right. Time for one more.
Sure. We have here Ben. So Ben is a younger guy.
Oh, wow.
But
That's got to be unusual.
it's not really unusual because these people, they're not advertising this situation. They're not going around and smiling and showing off what's going on.
Okay, so you don't see it.
They're hiding it from you. But
So
I'm
it's
telling
common.
you, these people are everywhere.
Do they ever say this is the worst teeth you've ever seen? Do they ever say that to you, Doc? Like, Doc, this is the worst you've ever seen?
There's always this assumption right before when we start and I want to take a look at things. They're like, all right, Doc, I'm warning you, it's bad. I always tell them, this isn't even the worst that I've seen today, right? It's a very common occurrence for people to think that they just got the worst mouth in the world, but these people like this are all over.
So I interrupted, so what did you do for him?
Right, so what I did for him is we did a full set of upper teeth. And so his lower teeth were still maintainable. There was a lot else that we could do, but for the upper, it was time to get a full upper smile with whole new upper teeth. So this is a different person. This isn't the person from before that was actively trying to be invisible so you didn't know what was going on. This is a person that wants you to know that they have a beautiful, healthy smile. They're showing that off. They're showing it all around town. He's going on more dates. He's gotten a promotion at work. I mean, everything is turned around for him.
It's very nice.
Yes, sir.
And we're completely out of time. So final message. So let's say, and by the way, let me just go over this one more time. This is a 3-step process. Patient comes in, you determine they're a candidate. Step 2, you design their teeth, their smile. Step 3, you get your new teeth. And it can be done in 2 or 3 appointments.
That's absolutely right. So a lot of these things can even be combined because it's a pretty expeditious process. So people come in, they tell me what they need, we take their scans, we take their photos, we get everything drawn up, and then a lot of times the very next time I see them, we're getting it done.
Okay, so somebody watching this, they're the 2 groups. Dentures, people with really bad teeth that are heading to a denture. Let's say they've heard what you have to say, but they're still skeptical. Okay. They're afraid.
Sure.
What do you say to them?
Just come on in and let's talk about what your options are. I do free consultations. I want people to come in and just get a better appreciation of what's going on and what we can do today. Because so many people just don't know what options are out there. And right here in the Tri-Cities market, we have the best option that is out there for replacing your whole teeth.
Okay, so no more dentures.
That's right, no more dentures.
All right, well, thank you for coming on the show. Good stuff.
Yes, sir, thank you.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.